All right. So, hi, everyone, and welcome. Thank you so much for joining us today. I'm Brianna Horan, Vice President of Clinical Sales at Galaxy Diagnostics, and we're excited to have you with us for today's webinar. One of the greatest challenges in caring for patients with complex chronic illness is that they rarely arrive with a clear clinical picture. Instead, they present with years of fatigue, pain, neurological symptoms, immune dysfunction, hormonal changes, or diagnosis like fibromyalgia, dysautonomia, MCAS, or post COVID syndrome. They often have seen multiple providers, undergone extensive testing, and tried numerous treatment, yet they are still searching for answers. As clinicians, we're left asking an important question: what are we missing? Today's webinar is about approaching that question differently. Rather than narrowing down the differential diagnosis too quickly, today's speaker encourages us to broaden our thinking, to consider the possibility that multiple inflammatory processes may be occurring simultaneously, including tick-borne illness. As she often says, pull the thread. Wherever you begin, if you continue asking the right questions and following the clinical clues, the underlying picture begins to reveal itself. At Galaxy Diagnostics, our mission is to provide clinicians with advanced direct detection tools that help bring greater clarity to these complex cases. But testing is only one part of the equation. Just as important is the clinical reasoning that guides when to test, how to interpret the results, and how those results influence patient care. Today's discussion will focus on that clinical thought process. Through real patient cases, you'll hear how Dr. Tanya Kramer approaches complex presentations, builds a broad differential diagnosis, recognizes when tick-borne illness belongs in the conversation, and incorporates direct testing into her decision making. It's my pleasure to introduce today's speaker, Dr. Tanya Kramer. Dr. Kramer is a physician specializing in preventative medicine, lifestyle medicine, metabolic health, longevity, and the care of patients with complex chronic illness. She is board certified in preventative medicine and public health, lifestyle medicine, anti aging and longevity medicine, obesity medicine, and addiction medicine, and has dedicated her career to understanding the interconnected systems that drive chronic disease rather than treating symptoms in isolation. What makes Dr. Kramer's perspective especially compelling is her philosophy that every patient's story contains important clues. She challenges conventional thinking by resisting the urge to narrow the differential too early and instead builds it outwards, recognizing that chronic illness is often the result of multiple overlapping contributors rather than a single diagnosis. Today, she'll share the framework she uses every day in clinical practice, along with 3 patient cases that illustrate how careful history taking, thoughtful clinical reasoning, and advanced diagnostics can uncover answers that conventional evaluations may miss. Dr. Kramer, thank you so much for being with us today. We're excited to learn from your experience, and I'll turn it over to you.
Thank you so much, Brianna. I'm really excited to be here with everyone. I really appreciate the chance to share my thinking around how we care for patients because I think that this has been an area that is certainly underserved and left people with suffering that we can mitigate, that we can change. So thank you so much for attending this webinar and considering how to create a better patient journey with me. So let's see if I can get us to go to the next slide. There we go. We'll have to do there. So as Brianna says, we have a practice called Elysian Longevity. It is located in Cary, North Carolina. And I didn't always think of Lyme disease or vector-borne illnesses. I in fact, really hadn't heard of it very much until I came to North Carolina. And suddenly I seeing patients who had a variety of symptoms that didn't seem to match up. And there were enough patients that I couldn't dismiss it. And that's how I found Galaxy. Actually, it was because of my patient's journey and my desire to find answers for them. So I think that one of the first things that we need to be related to is just our desire to understand our patient story. And if you are listening to this webinar, then you have already taken that leap of faith into a place where you say, yes, I actually think that there might be vector-borne illness, and I think that it actually might be responsible for creating patient symptoms. And so I want to commend everyone for taking that first step, because it can be quite a scary first step because it isn't authorized within the traditional framework. So kudos to you for starting that journey with your patients and believing them and believing their symptoms. So one of the things that I like so much about Galaxy is it was be able to answer my questions, my clinical questions as a provider. Um, and it was able to do that with a level of finesse and exactitude that I couldn't find elsewhere. It could give me a no and it could give me a yes. And I think that those are two very valuable sides of this equation so that we can actually appropriately treat and appropriately rule out. So Brianna
Can
already
get
shared a
this
little bit
done.
who she is. So we have a wonderful host here. And here's what we're going to be looking at. These patients are in your practice. You already know that there are people who, for whatever reason, continue to struggle. They will come in with labels like fibromyalgia, MCAS, dysautonomia, POTS, hormonal dysregulation, post COVID. I've even had them come in as labeled as autoimmune diseases, as far as multiple sclerosis to diseases like psoriatic arthritis. So we have a variety of labels that people have tried to associate with the symptoms that our patients have. But because tick-borne illness wasn't on that list of the differential, they didn't arrive at the correct conclusion. So instead of trying to narrow things down and use Occam's razor to find one source, there may be multiple sources. A single state and then disease is another single state, and you fall off from health into disease state because of one cause. If I would encourage you to think of it as multiple hits that get you to an illness state. And so what we're really tracking is what those multiple hits are that make you susceptible each time to a new level of disability. So yes, there may be things like a patient might have Bartonella and might have been managing just fine. But then COVID came, and COVID is a hugely inflammatory disease. And now the immune system cannot manage both. So now the symptoms have erupted to the level that they seek treatment from you. So it's not necessarily wrong to diagnose them with mold or MCAS or post COVID, but that doesn't rule out the fact that Bartonella or Babesia or Borrelia might be a driver in the background. So I do the opposite. I rule everything in and I say, what is possible? What are all the possible causes that would result in these symptoms? And that can be quite hard to do because it means you hold a lot in your mind. But hold the space for uncertainty, because that's the only place that that's the only way we will get to a solution that will actually help and transform the patient's life. So, so here's where you start talking about pulling the thread. So if we conceptualize health not as like as one state and disease as another state, and there's no room between them, but a gradual transition between the two, and actually that there are multiple balancing points along the line that would keep you more functional or less functional, or if you conceptualize health as a sweater or even a disease state maybe as a sweater, and anywhere you start unraveling any thread that you have to pull to improve someone's state will start to pull apart that knitting, and then you'll ultimately be able to unweave that whole sweater till you have a single line, and the inflammation, the suffering, the symptoms are gone. So with Lyme disease and vector-borne disease, one of the things we say is that if you've treated one patient, you've treated one patient. And that's because everyone comes in with their own unique set of pre existing insults to their health. So some people may have insults to their health that include COVID or multiple exposures to some inflammatory agent. There could be exposures from diet where people are not eating a very healthful diet or a diet that is appropriate for them. And that may be causing an additional problem for them. They might be coming in with hormonal dysregulation, or they might have significant mold exposure. All of those things are valid. All of those things are going to worsen the actual outcome and change the way that the person will respond to the medications and to your treatment. So it is worthy to have that bigger differential so that you can have a better guess as to how the whole system will move. Um, so when we talk about pulling the thread and going after the low hanging fruit, what we're doing is whatever the patient first thinks that they can do, whether it's, okay, I've decided that I will not eat fried food, that would be helpful to them. Or maybe it's like, well, I'm not going to eat gluten. Or maybe it's, well, I think that I can stop smoking. Or maybe it's even an intervention that of a supplement. All of those things are worthy because whatever that first step is that the patient thinks that they can do, that is the first step in their recovery. So take the easy wins and then build on that to build trust so that they can do the harder things. So, this a third part where I say stabilize first and then go deeper. What we're just trying to do, this first little part is quiet the inflammation, because if you can quiet the inflammation, then they are automatically going to feel better. And then that will allow them to take the next step with you. Okay. So the the thing that is most important, and we probably all have encountered this at some point in our training, is that the patient always tells you what they have. So that history is the most essential thing that you can do for that patient. First of all, it allows them the chance to identify and understand and contextualize their own story and the pain of that story so that they have the initiative to transform it. And also, it helps you to understand where these multiple health insults may have occurred. So, what is the cumulative impact of it, and how much you're going to have to reverse for that patient? So, really, this is one of those functional medicine beginning steps where you just say, well, when was the last time you felt healthy? When did you stop feeling well? It's really important to find out where they grew up and what they were exposed to. That's often where that first vector-borne illness might have occurred. If they were, as a kid, exposed to an area that where tick-borne illness is endemic, and then they went camping every summer, and they remember after going camping one summer, they got really sick, but then they sort of recovered. That's your window right there. That is the story of where that vector-borne illness started. So watch for those things. Do they in their history, do they have a history of lots of pets? Did they take care of animals and birds, or did they volunteer at a dog shelter at some point? Those are really important questions to ask because there could be unintentional transfer that has occurred. So you want to get a sense of their cumulative timeline. When they went to summer camp, say, and they came back and they didn't feel well and they had fevers. And then that fall, they had a sports injury that caused a concussion. Well, that's going to create a vulnerability because, as we know, Bartonella, for instance, is an intracellular organism and it can actually not only be in the bloodstream, but then line the blood vessels. And if it does that and we have a neurological injury, there's going to be blood flowing towards that injury to heal it. Now we have two problems. We have the original concussion and we have a Bartonella infection that has gone to that injured area. So we need to look for those things. We need to make sure that we take an occupational history. For instance, were they a vet tech? Were they involved in outdoor education? Are they a ultra runner? Do they participate in sports that would have them outdoors for long periods of time? And did they run the Appalachian Trail? All sorts of things like that. So it's both a combination of your occupational history and your typical lifestyle factors, and find out where the opportunity for infection may have occurred. And then look for abnormal clusters of symptoms. For instance, if there's significant joint pain in a young person, if there is a significant amount of anxiety, or if there is a challenge with mental health in the context of fatigue and joint pain and maybe ear or facial or sinus issues, those are unusual clusters. So look for those clusters that don't necessarily seem to be reflected in the labs, or the pain or the experience of them seems to be greater than what we would expect. And that's when we add Galaxy. Because if we find that and we find this, if we find a history, if we find the cluster, that's where we should start thinking there may be vector-borne illness in the background here. So the other thing that I do is, in order to not dismiss our patients, they have often come to us after having a multitude of tests, a multitude of other specialists, and what they have primarily received is invalidation. And so, one of the most important things that we can do is that we listen to them and we encourage them to give us the details. So, that means you need to take time, and you need to assume that that person is balancing their health better than expected. That these people, because they have made it all the way to you, have not only found a way of balancing on a precarious pinnacle, but that they are working harder at it than almost anyone realizes. So, really value them for their wisdom of their body and for their courage in seeking and finding you. And then start with the basics. Find out their history, but then what are their symptoms now? The likelihood is that they have a wrong diagnosis, that somebody has given them a label that was sort of helpful in talking about their symptoms, but is incorrect in terms of their treatment. So find out what those symptoms are. Can they move their body? Can they eat? Are there digestive issues? Are they bloated? Do they find that they are supremely sensitive to all foods? Are they sleeping? Do they go through periods of insomnia? Do they feel restored? Are they constantly chronically fatigued? And then look for other things as well. Look for their social connections. Chronic disease is supremely good at isolating people. And then that can compound the experience of pain that and the sensitivity to which people experience their symptoms. So pay attention to that and recognize that loneliness actually has physical signs as well. So see if that is a component in the experience of their lives. And then look for any sort of addictions or repetitive habits in either behavior or substances. And this can even take on a kind of OCD sort of typification, because they are trying so hard and working so hard to balance something that is a disease state. There can be things like, oh, I have to take 3 garlic pills every morning or I don't feel well. Like, find out what that means and how often that occurs. So, as we are keeping that as our framework for how to interact with patients, so that's the starting point of what our gift is to patients. Our first gift is that we listen to them and that we believe them and we allow them to share their stories, and then we document accurately what their symptoms are and what their history is, so we can find the the thread that would connect us to vector-borne illness. So let's go through a couple of cases that I have encountered in my practice. So you can see what this looks like on the. So there was a patient of mine who, and let's just give her a name. This is not her name, but we're going to just name her Sally. So Sally is 39 years old, and she kept having these waxing and waning problems with vision, where she would get kind of like a tunnel vision and then it would go away. And I thought, well, that really doesn't seem helpful. Like, and it would just go, and then it would kind of go blurry, but there was no ophthalmological problem. Nobody could really explain it, but she just had these weird vision experiences and didn't know how to typify them. She also felt tired and that her extremities felt really heavy, like as if she were moving through mud. She would have facial pain, experience pins and needles, sometimes in various joints actually, and that it would move. So it wasn't always the same joint. So that's an unusual presentation as well. She had jaw clicking, TMJ, and then anxiety. Part of the vision problems was that she would have photosensitivity, and then she would have this reoccurring chronic sinus infections, brain fog, heavy periods, weight gain, and so she did not was not feeling good. She shared with me that several years earlier she had been diagnosed with Lyme disease, and then that was treated with doxycycline. The other thing that was really interesting was that she was actually the director of an outdoor education in upstate New York. And so her entire job was taking kids out on the mountain and coordinating that and camping with them. So she had on a weekly basis a potential for tick exposure. And so we ordered the Galaxy, and when the results were returned, the provider she was initially working with didn't think that that was like, oh well, that's probably not something to worry about. And my thinking on that was very different because having worked with Galaxy, I can feel very assured that if the serology comes back positive, that we are looking at an exposure. If the BBB comes back with a digital PCR, then we have definitively caught an organism. So that organism is active in the system and is causing a problem for that individual. And Bartonella is perfectly happy to cause all these problems. So when we got a positive result from both the digital PCR and then we also get serology that was positive, on a single draw, I knew that we had to start treatment. So we did initiation of the treatment at that point because she had done doxycycline previously. I certainly didn't want to start with doxycycline. We want to make sure that we start with a couple, well, 2 to 3 different treatments because otherwise you can get and create persister Bartonella. And so we started with azithromycin, methylene blue, and lumbrokinase to break up any fibrils and to start to address the concerns with Bartonella. And she's done very, very well with that. The immediate thing that went away was the brain fog and the fatigue, and the vision was just almost immediately within weeks started resolving. In fact, it started and it was working so well that she thought she was cured. And she was like, oh, I don't have to do this anymore. And I had to tell her, no, 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 that's not how we do this. Because unfortunately, Bartonella does have these persistent organisms, and we do have to cover in our treatments for that as well. And here you can see a statement about this particular patient. And one of the typical things is that her labs look relatively normal. Like we wouldn't, most of these labs don't give us any indication that there is a chronic persistent disease that is causing neurological and metabolic symptoms. So when the standard labs come back and they look relatively normal, that's another clue that you need to start digging to the next level. And here's why I stated that I decided to order the Galaxy. She's under 40. She was physically fit. She was out trekking around, toting camping gear every week, working with kids, high energy level, and she was exhausted. And she had joint pain everywhere and hormonal dysregulation and a remote history of Lyme disease. And I thought, I I think we're there. I think we have enough to justify a Galaxy test. The amazing thing was that it came back with a single draw, and that is in my mind, a really strong signal because it is very easy to miss these potentially persistent organisms that can stay quiescent and evade the immune system as an intracellular organism. So to have something come back as high as it did, at the levels that it did in her in one draw was significant.
I remember when you shared this case with us, Dr. Kramer, so I'm glad to hear that she's doing better. We have about 15 minutes left, and I know that you have two other really strong cases that I want to make sure the audience gets to hear. So if we could just jump to case two, that would be great.
Okay, thank you. Okay, so this is a 49-year-old female, and she came in and she said she had her joint pain and fatigue were so severe that she felt like she was falling apart. Again, we saw the hormonal disruption, we saw the weight gain, and we saw the brain fog. And she had been diagnosed with psoriatic arthritis. And I asked her if she had any skin symptoms. She did not. I asked her if they had found positive antibodies, and they had not found any of that for any autoimmune disease whatsoever. And then they had actually put her on Humira, and she had not experienced any improvement whatsoever. And so I looked at her and let that just sit with her for a moment. And then I said, I don't think you have that disease. And she said, "I'm so glad you said that because I've never thought I had that disease." And I thought, okay, well, now we're getting somewhere. So it doesn't, her history didn't include a tick bite. It didn't include any history like that. But this cluster of the fatigue, the joint pain, the hormonal changes, the weight gain, the brain fog were sufficient for me in this case. And so that was when we did a Galaxy test. We did it for the three draw, because I think that that's the best chance of finding that digital PCR. And actually, two petitions found a Bartonella sample. So again, a really manifest, a really strong and disease state where the Bartonella were quite active and causing all these problems for her. And then we were able to initiate treatment, and she feels great now, which again is great. But after the experience with the first patient, I started telling people right up front, hey, we have to continue this. So we do a short version of the azithromycin, the methylene blue, the lumbrokinase, and then we've got about a year of herbal treatment after that because you have to catch those persisters as well. So, and think one of the telltale things is when someone who is relatively young or under 50 telling me that they are falling apart, that is a significant sign for me because someone under 50 should not be falling apart. They should have a significant amount of health bandwidth and should be able to, in fact, she did, which is why she was actually able to precariously maintain that balance. So, again, go back to the symptoms, start from the drawing board. Don't start with somebody else's disease designation. The other thing we want to just touch on briefly is that tick bites, they don't produce a rash all the time, even when you have a known tick bite. So, for people to say, oh, I never had a bullseye rash, well, most people don't. So if you're looking for a rash, you will miss it. If you are looking for only ticks, you will miss it. Fleas are a very common vector, lice, spiders. other insects can carry these diseases and then they may be forgotten. Like a spider bite will go away in a few days. It will raise a lump and then by a week it's gone. And fleas are very common on household pets. You may not even realize that. You might have had lice in elementary school as a kid. All of these will cause a problem. So the question is, was there the opportunity for an exposure? And then how frequently might that exposure risk have been experienced in the environment? Again, the symptoms will be out of proportion with what we would expect for someone either by their age or by their labs. Again, this is the first visit. Why it's so important. You want to create an environment where you as a provider are very human because the patient in that environment has come in after seeing maybe 15, 20 other providers where they were given a snap diagnosis, they were given a misdiagnosis, they may have been given a label that didn't even fit them. And they are still feeling sick and they are still coming in there with courage. They do not need you to be perfect. In fact, because the way that these diseases work, we don't have perfect protocols. There are going to be some missteps. So it will be really important that you are relatable and that they recognize that you are flawed, but on their side so that you can get it wrong and they don't stop trusting you or working with you so that you can continue to find the treatment that is going to work for that patient. So what is it like when you have to tell someone that they've been misdiagnosed? A lot of times they will feel relief because they know it. So I would not be afraid of that. The real question is how much of their personality and life have they had to invest in that diagnosis? And that's where the danger comes. Because if they have integrated that into their personality, then they may not be able to give it up or dissociate from it enough to heal. Okay. Let's see. And then the third case we want to take a look at is that of a 75-year-old woman. And she had so many diagnoses. She had been given fibromyalgia, chronic fatigue. She's been told she had dysbiosis. She had mold. She had INCAS. She had depression. She had chronic migraines. So every list of her illnesses was extensive. And that can be daunting as a provider to have somebody who comes in and they have 15 different medications and 27 different diagnoses. That looks alarming. Again, go back to the history. What are their symptoms? Are they sleeping? Are they eating? Are they able to function in their lives? Find out what their baseline is and then build from there because not all of those are going to be correct. They're pointing at something, they may be describing something, but they may not be the diagnosis. And so she has been working on her health for a very long time. And in that time period had not only acquired all those diagnoses, but acres of tests. So when I first suggested that we try Galaxy, she didn't want to do it. She thought that it was just another test that was maybe going to point her in another rabbit hole where she wasn't going to get better. So it took about a year of me working with her and like I said, pull the thread. You just start anywhere that patient can start removing that inflammation, start helping them and move them forward 1 inch at a time. Ultimately, she was able to agree to do the Galaxy test. And when we did that, we found out that she had the nanotrap was active and was positive, and that she had Borrelia. So that was a really big win. I was able to tell her that she had a definitive disease state that we could treat. However, even after telling her that, we know that patients don't really know much about these vector-borne illnesses. So it's like just another one of her many diagnoses. So, and fits already her pattern of fibromyalgia. So she can't tell the difference. And I think that that's where we get the challenge. Because even though I'm telling her, hey, we found something, for her, it really didn't change her mind. It because she thought, okay, well, it's just another thing. But what I can tell you is when we started treating her, she moved from having sunglasses and her head always hanging down and pale skin and always her voice sounded like mm, Eeyore on from Pooh, where hello. She always was so unhappy to coming in and starting to like her skin started to become more pink and she started playing pickleball and then she started laughing with me during appointments. So there really was this massive transformation that happened for her. And I think that that is one of the most valuable and powerful things that we can take away from this work is that this is not just diagnosis of an illness. This is somebody's transformation of their life and it gives them back their life if we can use the Galaxy results to actually treat them and help them recover their energy and their well-being. So, from this case, please always remember fibromyalgia is pointing at something. It is not really a helpful diagnosis. It is pointing towards a cluster of symptoms and not the answer in of itself. And it can actually be one of the things that point us to actually a need for galaxy testing. Uh, So, with this particular patient, this is one of the things that we really need to come to grips with is that this poor woman spent over 40 years of her life ill. And if you are ill, like she must have had a huge health bandwidth to make it through 40 years of illness like this. So if you have a condition that has for 40 years of your life kept you from friends and family, she never married because how could she go out on a date? She always had to cancel because she was too exhausted. And then when she would show up and want to do things with family, she didn't have the energy to do it. Like she could get exhausted just from trying to eat dinner. And so the family started to look at her in a certain way. And the diagnoses that she received from other providers gave her labels. And so the weight of all this 40 years of people looking at her like she's the problem, like she doesn't really have something, like she's actually maybe making some of this up or exaggerating this has a consequence. It changes the way that people feel about themselves. So, part of our work here is to recognize that in our patients and to make sure that we are attending to that level of their uh, disease as well. So, one of the things I really want to emphasize about Galaxy is that there are those serology measures, which are excellent. They, I think, in my opinion, are the best that I have found. And that's why I'm doing this webinar so that you know how good they are. These serology measures will capture an exposure. And then the digital PCR is excellent because that tells us, is it in the bloodstream? Can we capture it? Can we get one of those or is it, with the nanotrack, is it in the urine? Can we see it? When we have a yes on either of those, my personal suggestion would be to treat them. The likelihood is if it comes up in the serology that they haven't been treated appropriately for it and that they have persistent disease. So this is what standard testing is going to miss. The serology panel of the IgG and that answer is really strong, really important to know. Has the immune system seen it? Because if it's seen it, and the likelihood is it hasn't been treated, we need to treat it. If we catch it with the digital PCR, we've nailed it. We just caught that organism. Uh, So we know that it is active and then is creating disability for that person in real time. And then there are the urine antigens with the Borrelia. Like I said, this is an amazing differentiator. It helps us understand whether it's present or not and if we can. So these patients who have vector-borne illness, are there in your practice now. They're going to have labels that are catch-alls and are going to be describing something, but not giving direction towards what needs to be treated. Often, tick-borne illness has not been on the list. And so, if people are coming in after a lifetime, say even 40 years of being marginalized and not treated, put it on the differential. You don't have to get it down to one driver. It doesn't have to be the only incident that impaired their health. In fact, it probably isn't. But it may be one of the strongest roots that if you can clear that organism, if you can clear that disease state, then the inflammation elsewhere will reduce. And suddenly they might be able to eat foods that they haven't been able to eat before. Because the inflammation of the body's reaction is no longer there. So a negative story, a result is not going to be the end of the story. We know that there's persistent disease. We know that they go quiescent. We know that these states that they also do things to evade the immune system, like other gram-negative bacteria. It's very well documented that Bartonella does something called blebbing, and it can actually cause like the misdirection of the immune system, and so that it can persist in these very low energy states. So just because you don't catch it in the digital PCR doesn't mean it's not there. The critical thing that I am talking about today is the relationship that is really important to develop with your patient, one where you are human, where you are allowed to be flawed, where you guys jointly can make mistakes and revisit the treatment and change it, but that trust and that willingness to be in their corner needs to be created. And then just pull whatever it's easiest for them. You will get there. Just keep going back, keep thinking through it with them. And then any questions?
Awesome. Dr. Kramer, if you could just advance to the next slide while we ask the audience if you have any questions, please go that I haven't answered already in the chat. Please go ahead and stick them in there so we can ask Dr. Kramer. But Dr. Kramer, we do have three questions so far. So the first one is, what other markers do you order from other labs to search for other diseases related to Lyme or mycotoxin toxicity, heavy metals, environmental? And if they're positive, how does your treatment plan differ? Methylene blue could be multi-purpose treatment. And honestly, I even get asked this question a lot, right? If both things are on board, mold and tick-borne illness, or a history of tick-borne illness and mold and all these other assaults from the environment, what is a clinician to do first?
Yeah. So my position currently is that tick-borne illness or vector-borne illness is the root, and then it creates an inflammatory state where it's going to be more reactive to environmental insults like mold. So you really, in my opinion, I would like to treat the root, which is that bacterial infection first. That's what you go after because that is something that you can take action on. Mold is the entire environment, and it can be not only in their work or their home, and you should search for those things, but that is a little bit more nebulous. Whereas for me, the tick-borne, the vector-borne illness is very concrete. Like, if we find it, we treat that because that makes everything else worse. And in terms of, I think the question was about testing. What testing do I order? So it depends. There are a variety of labs out there. I don't tend to order anything from if I think there's vector-borne illness, I tend to order Galaxy because I have not found other testing to be as distinct, as discrete. Some other labs use IgM, which is very sticky and can attach to everything, and then it's really hard to tell, or their IgG serology doesn't map as well to specific Bartonella subspecies. And so then we end up with something that is uncertain, like whether we're actually getting a true result or not. So I tend to stick with Galaxy. There are a number of labs that can be helpful using urine and urine metabolites to look at mold and look at environmental insults.
Thank you. So there was a question regarding if these tests determine biofilm location and severity. So short answer, no. Biofilms on board, part of PCR testing is bead beating to break up biofilms to better expose the DNA in the blood sample. So we do things to mitigate for biofilms, but to actually determine where the biofilms are, no. Or the severity, no. 12 years of doing functional diagnostics, I've gotten that question a lot. So to my knowledge, in my experience, tests like that do not exist yet. Yet. All right.
I
So
think it's reasonable to assume that biofilm is there. I mean, it's a gram-negative bacteria. I think it's and it functions similarly to. So I think we have the clinical suggestion that it functions like other gram-negative bacteria, and so we should expect that biofilm is there. And so that's why things like a lumbar kinase or other things to break up that biofilm should be part of your treatment plan.
great. So, if someone has a new patient recently bitten and they did start doxycycline via the urgent care, will this cause a false negative on the urine antigen test? I'm happy to take this one.
Yeah, you can take that one.
The official answer is studies have not been done, right, on exactly when those spirochetes release those antigens relative to when the antibiotic got on board. And there is no test for cure. So if the patient has started antibiotics, we recommend do not collect for the urine. Ideally, they would collect for the urine before they started the antibiotic treatment. And as far as how soon you can test to a tick bite, we would say about anywhere from 3 to 5 days, you can start testing. If you get an early negative and the patient then starts to develop symptoms, we would want to retest. In terms of, well, when can you test after an antibiotic? I would say if the patient's feeling good, save the money and don't test. But if it's 3, 4 weeks after the end of their antibiotic treatment, if they start to develop some symptoms or they're curious, you can go ahead and run the urine antigen test. We have some more details and some studies done in chronic PTLDS that I'm happy to share. I had sent Talia's email in the chat a few times, so you can always ask her for that information. All right, next question. With an elevated H. pylori, elevated Pseudomonas, would you treat the Bartonella and Babesia first? I can say that again.
Okay, so if we're looking at something that's like a dysbiosis test, like a stool test, then yes. Well, here's the real answer is my preference would be to treat whatever we found on the Galaxy test first, because I think that that is going to be the most insidious organism and the one that we will need to eradicate and work towards restoring the body, because Bartonella is nothing. Actually, none of the Bartonella, Babesia, Borrelia, they have the capacity to create neurological changes, and so they can get into the bone marrow. They can create widespread havoc. So, in terms of their capacity as a disease state, the vector-borne illnesses are boundless. Really, so we really have to go after that. So, but if we're looking at a stool sample that has said H. pylori and Pseudomonas, we don't necessarily, we're not trying to dismiss that. However, the likelihood is in the treatment of whatever we've found on Galaxy, we will actually also be addressing those organisms. We may have to go after the H. pylori or after the Pseudomonas a little bit. We may have to incorporate some of that into our treatment plan. As you probably know, Pseudomonas requires multiple treatment interventions. So it isn't like a one antibiotic and done, and neither is H. pylori.
All right, great. Have you been finding alpha gal in your patients, and is that part of your workup?
That's a great question. So both alpha gal and Rocky Mountain spotted fever do come from a tick source. So, but that those we do have a little bit better ability to pick up through labs like LabCorp or Quest. So I do test them. If I get a positive Galaxy tests, do I automatically get those as well? No, I don't. It really depends on the symptoms. We know that alpha gal creates some problems in terms of food toleration. And so look for it sometimes, depending on what the symptoms, the presenting symptoms are from the person.
And I know some of you have been asking for the resource of the patient identification guide in the chat. So we'll make sure that that's actually, I've had enough of you ask, so we will make sure that that's part of sending the recording as well and including the price sheet. Anybody interested in the pricing as well can email contact@galaxydx.com. We do not take insurance. At this time, we are a cash-based lab, and the price ranges between 300 and 2,000, depending on the bundles and what pathogens you want to test. So with that, this concludes our webinar for today. We have tons of resources as well on our website, including the Vector-Borne Diagnostic Landscape Guide, which is a pretty unbiased document walking through all of the different test methodologies, including Galaxy, and the pros and cons, and when might be a good or not so good time to use each test. So we are definitely committed to broadening the education that's out there. Dr. Kramer, thank you so much for today. This is a lot of information. Those cases were great, and I'm sure all these practitioners can see these patients in their own practice as well.
Thank you so much for having me, and I hope that this is helpful to anyone who joined us, and that you stay encouraged to keep trying and keep searching down these pathways with with your patients.
Great. Thanks, everybody. Have a wonderful day.